One of the things I look a great deal at, I've worked over the years, is working with diet as far as pH and balancing the acid-alkaline. That's always the foundation, because if the body's too acidic, we said, again, the body can't carry enough oxygen. And that's another thing why people start to gain weight with chronic fatigue, don't have the energy, because our body's built to survive. We've touched on this before, so it will have a backup system. If there's sufficient oxygen, each cell has what's called the mitochondria, which is the powerhouse of the cell. If there's sufficient oxygen, you'll go through an aerobic metabolism. It'll produce 30 units of energy, roughly, per every cycle. In the absence of oxygen, we'll go into an anaerobic metabolism, and it only produces 3 units of energy per cycle.
Boy.
So that's 10 times less efficient. And so you're just, running on idle, because it's going to help you survive. It was a good mechanism, but you weren't meant to live your life there. So that's important to recognize all these factors that influence our vitality being depleted and diminished.
And it's up to us to kind of be proactive in our own health now. I mean, somebody's not going to walk in there and go, hey, don't eat that, or drink more water or anything. You really got to do it yourself. Well,
again, but you need a coach many times, because it's hard to evaluate yourself. That's why I like to play that role and work with patients again on looking at the 6 essentials. Another factor with diet, before we go on, that I really find very, very important, because we were talking about allergies. And sometimes those allergies are like subclinical, just a little bit of extra mucus or headaches or something. And I have found that working with the blood type, there's a whole aspect of eating right for your type that a naturopath named Dr. Peter D'Amo put out a few years ago. And there's a lot to that, because he lists foods that are beneficial, which act as medicines for each blood type, foods that are to be avoided, which act as poisons, and then a whole list of what are neutral foods. And looking at that and combining that with the acid-alkaline balance is a very, very comprehensive way of looking at diet.
Is that kind of what, like the Ayurvedic methodology? They're describing people by body type.
They're doing it a little differently, because they're doing it with what they call doshas, Vata, Pitta, Kapha, and they're measuring it through pulses. So it's it's 5,000-year-old system. It's a little different than what we're talking about now, because of course they didn't have the technology to type blood.
Right.
But they were trying to classify it. Yeah, just like so many of the ancients, they would classify people in certain groups, and what was food for one or medicine for another would be poison for.
Yeah. One of the things my wife's finding as an acupuncturist is she'll observe everybody's pulses and all the different things and determine things that they ought to modify in their lifestyle. But they would rather come in to her and get acupuncture and hope to get a quick fix than change the way they. How do you address that? That's got to be happening with you.
It always happens. It's a human predicament. You remember the definition of insanity is doing the same thing and praying for a different outcome.
Yeah,
we all want to do that
5 times and it still hurts. I don't
exactly. So, most people don't want to change their lifestyles. That's why modern medicine is so attractive. And we see, and it's even gotten worse over the last several years because there's so many commercials. It's even hard for the medical doctors, because they may want to work in a certain way or prescribe a certain thing, but people come in, I want this blue pill,
sure.
or I want this or that, because they've seen it advertised.
Ask your doctor about,
And even if the doctor doesn't feel it's the appropriate therapy, many times he feels coerced into prescribing it, because they'll just go to somebody else who will give it to them. So they don't have it easy either.
No, they don't. And, we could do a whole show on pharmaceutical company manipulating, people to buy stuff.
Yeah.
But more importantly, in fact, that just kind of reminds me that that supplements thing I was talking about, that's another panacea for people. Instead of modifying a lifestyle, they go, oh wait, I can still go to McDonald's. I'll just take adrenal supplements. I know I'm making that up, but what they're not realizing is that's the most. That kind of fast food mentality is the most horrible thing they could do to themselves.
Absolutely, absolutely. And we do use supplements in our practice. Most of the supplements are designed as whole food supplements to help improve the alkalinity, but we do have supplements specifically targeted to support the adrenal glands as well. Yet I never use them in isolation. I find out what is causing the misperception, what is causing them to be stuck on running an emergency all the time, clear that, give them some tools, and then support them with some supplements so that their body can build.
So, let me ask you this. Do people come to you in a preventative way, like they'll come in before they feel horrible and go, hey, I heard about you, I know what, he's laughing at me already. See, so my point being is that people wait until they're like some serious thing wrong and they expect you to fix them.
Yeah.
And that's the kind of stuff that people have to get out of their minds.
It is, and I do have some patients that come for wellness care. And that's really exciting when someone says, I'm feeling great, I don't want to stay this way.
Yeah.
And how can I learn how to get better? Or they know that there's a family history of something and they're younger. How can I avoid going the same direction that my parents did?
Yeah.
And making the lifestyle changes. And it takes looking, really being honestly and looking at what am I choosing and what are the effects, really understanding the cause and effect nature of the physical universe.
One of the things that I was going to ask you about was there are certain things we have no control over. Air quality, what we're breathing. Up here, that's a major concern. Is there a supplement for that, or is there something that will help your lungs to stay healthy rather than suddenly become cancerous for no reason because you've been breathing bad air?
Well, again, there can be bad air, but there always has to be a trigger along with that. And again, if you have an overly acidic condition and your immune system is suppressed because you've been in a chronic fight or flight response, you're going to be more susceptible to developing cancer and other diseases. And again, the devitalized foods, because there's not enough B vitamins, there's not enough vitamin C, there's not enough magnesium. So right off, a good B complex and a good vitamin C supplement and a good green food supplement is a core supplements for most people, because even eating good organic foods, the modern living is very, very stressful, and we can be using up nutrients faster than we can put them in, even with our whole foods.
Yeah, everybody expects to be able to get someplace chop now. Like less than 150 years ago, you were riding in a cart pulled by a horse. Now, if you're not going 70, you don't feel like you're going fast enough.
Look at the information technology. What was it? The Pony Express was the fastest means of getting information across the country. I mean, how long ago was that? About, 150 years ago? 100 years ago? 150 years ago?
Late 1800s.
Yeah, and now, we want the next best computer because I want to press a button and get it immediately. I can't wait 5 seconds for the screen to come up.
Yeah, don't get me started on this computer thing. My son just put B.E.S.T on one of our computers and we had nothing but trouble. All right, well, in the last 5 minutes of the show, I know it's run so short with you, but
is it really 5 minutes?
Yeah, but let's mention again. Dr. Don comes to us from the Vibrant Living Center. It's located on East Main Street, 1097 East Main Street, Suite G, and that's in Grass Valley. Dr. Don is a CD on the pH and the acid-alkaline balance that we were talking about earlier, and that stuff, I know from my own personal experience, it's really important to keep yourself in a balance.
It sure is, and that's why you were saying, like, your wife is on a raw food diet and other people doing living food diets. Those provide the alkalinity. That's one of the things that are so good about those diets, is because they're high alkaline, high water content diets, and because our bodies are 75% water. And another big thing for chronic fatigue is dehydration. Huge.
So how much water are people really supposed to drink a day? Is it a personal issue? Is it like subjective, or is there a
subjective
rule of thumb?
Is difficult. The general rule of thumb I've used that I seem to be the best is a ½ ounce of water per pound of body weight per day.
Oh, that makes sense.
It's an easy way to calculate it. In a minimum, that comes down for most people real close to that 8 ounce glasses of water a day. That's a minimum.
8 ounce glasses.
That's a minimum. And again, if you exercise heavily, you may need more water than that. And again, it should be pure water, not what comes out of the tap.
Yeah. Let's, if you would like some more information from Dr. Don, there are a couple of places. The phone number, 530-271-5921, or to reserve space for the event. Again, March 13th, it's a Tuesday at 7 p.m. And then email Dr. Don at livingvibrantly.com, and that's your website, right? Livingvibrantly.com.
Yes. And we have all of our programs listed. We're going to be doing a program on a different subject every month, right through August.
Wonderful.
Or September this year.
Is there any final information that we didn't get to?
Wow.
How about picking a couple of things we didn't get to that might relate to chronic fatigue, that somebody may not know they have chronic fatigue and they might want to take advantage of this?
Again, it could just be a generalized, as we put in there, a lack of the joie de vivre. You know, just not having the interest that someone had in things in their past, or, you know, having the passion in their life. It could be as simple as that. And not having, you know, that interest and that focus. It could be a lot of things as simple as that.
A couple of things that I see in here, you know, joint pain and things like that. You may think, oh, gee, I worked out too hard, or I went skiing or something. It's something else to pay attention to.
You know, inflammation is a huge thing.
Yeah.
You know, because again, that acidic condition creates inflammation, and the body's not regulating its inflammatory responses. I mean, it goes on and on and on. And we'll go into depth in the talk, and go where people want to, where they want to learn, and go into depth where their interests are for that talk.
This is nice. Well, thanks for coming on. Please come on again. I'm sure we have plenty more to talk about.
Thank you, Lou.